age spots or eczema can serve as warning signs for other illnesses in the body, such as leaky gut, parasites, and certain autoimmune diseases.
Thank you for joining us on our continuing Women's Health Secrets journey as we explore how the keys to your health may be skin deep.
When I was a kid, I had a lot of health challenges as a child. I had a lot of allergies, and a lot of it showed up on my skin. I had eczema and hives and mysterious little bumps that would appear on my face or various areas of my body, and they'd be itchy, and so I was uncomfortable and always feeling that. It was just incessant itching. And then I was also embarrassed. I remember being really embarrassed about the appearance of my skin, and it wasn't something that I could hide easily. And my parents took me to see a lot of different doctors, different specialists, and I was put on various medications, many different medications. I had adverse reactions or allergic reactions to everything that I took. And I remember at one point, one of the doctors even said, I think she's just allergic to everything in our area, so you should probably just move. They didn't really have anything else to offer us. But I just felt terrible.
As I had been struggling with a skin condition from the time I was a teenager, I had horrible eczema. Yeah. And anyone who knows eczema, it is just this itchy, horrible, sort of incessant, completely crazy making thing, and it's so common now. It's really frightening. And when, so I got it when I was, 14, 15, not the time you want to be having sort of itchy red rashes everywhere. And I basically went the medical route. I'd been eating standard American diet all of my life, and, doctor prescribed cortisone cream, and it worked. So it started off inside of elbows and under knees and these kinds of things. And over the years, it just kind of kept getting worse and worse, and I'd get higher doses of the cream and more of the cream. And I can remember it got to the point where it was systemic. It was everywhere. Yeah. And I got it on my eyelids. Wow. And I remember when the doctor was like, oh, just put the cortisone cream on your eyelids. There's a little something in me that was like, it kind of feels like I'm going to burn off my eyelids. I really didn't know anything, but it just felt like a bad idea. And I was like, but why is this even happening? This is, and I felt like I was living a really healthy life. I was vegetarian and I was really active. And I, for every other thing, I looked healthy except for the skin thing. And so a friend of mine recommended that I go to it was a naturopath. I don't know, that was way back in the day. We didn't talk about functional medicine at that point. And so this doctor did a whole bunch of different tests on me. At the time, I had no idea what she was doing. But what she was doing was identifying food sensitivities. She was looking at some gut issues, some liver detox issues. She massively overhauled my diet. And within a matter of a few weeks, it was gone, and it never came back. And I was like, oh, so I guess there's this connection between what I eat and how I feel. And that was literally the first time the idea had even dawned on me. And I remember joking to my boyfriend at the time, oh, she's going to take away all my favorite food groups, like wine and chocolate and cheese and bread. And oh my God, if it had just stopped there, right? It was so much more comprehensive than that. And it was definitely an overwhelming process for, coming from where I was. But my God, it worked. Yeah. And I was just sold.
And thankfully, my parents didn't give up looking for solutions for my health. They kept searching, and they found a holistic practitioner that they took me to. And it's the one thing that finally turned my health around. And I remember feeling not only the physical relief, but also the emotional relief and that ability to kind of feel like a regular kid again. And so I also remember thinking, why isn't everybody offered this approach right at the beginning? Why isn't that an option that everyone is presented with? Why did I have to go through all of this? And so I realized at a young age that was a very big passion of mine. And it's eventually what led me to go to naturopathic medical school. And so when I was listening to my patients talk about how they didn't realize the connection of their skin to all the other things that were going on with their body, I realized this was a message I wanted to get out to more people. So that's what led me to write my book, Clean Skin from Within, and also what led me to create my natural skincare line.
And look at this, endocrinologist recommended me to remove my thyroid, chose to make changes and trust God. Today went to get my ultrasound and no tumor. Oh my goodness. Oh my goodness. Thank you for encouraging us, Rebecca. Wait, hold on a second. Hey, Rebecca, forgive me for doing this. You can obviously decline what I'm trying to do right now. Hey, Rebecca, was that you that said that?
Yeah.
Oh,
Isn't
awesome.
it amazing?
Well, tell me, I mean, what happened?
So back in June, I went to my endocrinologist, and I just kept asking the questions. Well, what caused this? And the typical answer, oh, hereditary, or we don't really know. And I told them, I don't feel like that's the answer that I'm looking for. I need to know what caused this so I can resolve the problem, because resolving it by taking up my thyroid is not the answer. Then I'll have to be put on medication. Connected with this by God, not by chance, and just really started diving into the information. I've been honestly doing this as if I'm in school. Went back today to our doctor here, who is an ultrasound doctor and radiologist, and he's like, it's gone. He goes, all you have is 3 calcifications, but it's gone. But I wasn't surprised, because I knew, out of diligence, out of perseverance, have just like cleansed my body of those emotions. And I'm just lighter on my feet. I feel, more connected, even because there's not like that beast inside of me, where the thyroid just takes over so much of your body. It's connected with so many parts of your being. And I wasn't being the mom to my 4-year-old that I wanted to be. I wasn't being the wife, to my husband that I wanted to be. And I just knew there was a better way.
So take a second to think about a woman in your life that means the world to you. It can be your mother, your daughter, your sister, or your best friend or neighbor, or maybe just a friend who you know is struggling with her health right now and maybe needs to save her money for medicine or groceries. Maybe she's also watching the Women's Health Secrets episodes, or maybe she doesn't really know about this docuseries or doesn't have enough time to watch all the episodes this week. There's something you can do for her right now. Once you secure your spot in the Platinum program, you can give her a free version of the program. She can watch all the episodes, read all the transcripts, listen to all the MP3s, implement the healing protocols, and participate in the live events. She can start her healing journey when you start yours, so you can encourage each other and keep each other accountable. You can get this for her and she won't need to pay anything, because you'll give her a free buddy pass to follow the program without paying another $197. This is an amazing opportunity for her to transform her life, and you can nudge her in the right direction by simply giving her a free buddy pass and encouraging her to go through this program.
If that's something you'd like to do for a woman that you love and care about, simply click the button below, choose our all-inclusive best value.
So I said, we can fix this so that this doesn't happen to you anymore. And within 3 months of working with me, we had to start therapy the very next day because she had an ACE score of over 6, terrible trauma in her childhood, and current day drama in her family, her current family. And then we changed her diet. We got her on a good exercise. We did a bunch of functional medicine laboratory testing. And within 3 months, she'd lost 20 pounds that she needed to lose. The puffiness was gone. Her skin was clear. And she was well on her way to having ease and happiness in her life instead of all the family trauma. Now, I tell her story a lot. I wrote about her in Solving the Autoimmune Puzzle too, because she's not this neat little tidy bow, She actually is very good about sending me a text with a picture of more hives every time she starts to get off track. So she'll say, oh, I've got hives again. And she'll say, one of my kids had this emergency, and then I responded with this big drama, and now I've got hives again. I need to come in and get back on track. And I love that because she now is in this collaborative relationship with her body instead of a combative one. She knows when she's out of integrity mentally and emotionally with her physical body, and she can get back in sync. So that's a really great way. And that's, to me, the goal for all of us, is to be in a good collaborative relationship with our bodies. When we achieve that, then we're happier and healthier.
In terms of when people learn your age, what kind of reaction do you get, just honestly?
Oh, definitely. Yeah. So people say I look like I'm in my 20s. I've had men who are in their late 20s ask me on a date. I'm not married. I'm a widow. My husband was tragically killed, and I always say, I'm old enough to be your mom. So, no, thank you. Which is embarrassing, but I don't even want to say like it. But most people would say, I'm in my 30s. In fact, one of my good friends, she says, I'm 10 years older than you. And I said, well, what year did you graduate? She says, 91. And I said, that's when I graduated. We're the same age, girl. And so it does blow them away, but it gives, I think, a testimony to, we can actually go in reverse. If we can reverse heart disease, right, and we can reverse cancers and diabetes, then why can't we reverse the effects of aging? I mean, theoretically, our bodies want to live to be a ripe old age, right? Our bodies will just try to live as long as it can. So if we can reverse the effects of aging by using high phytonutrients and fruits and vegetables grown in season and all these vitamins and minerals that we should be getting from our food, not a pill, right?
Yeah. Well, I mean, because you get older.
Yeah, you get older. And I think, sometimes, we're gonna have maybe some outward manifestations of just growing older.
Yeah.
But I just believe that I've seen it happen. I've seen people who had brown eyes. This is going to sound crazy. I know a girl, Christina, she had brown eyes. She started doing more plant-based food, raw food. Not that people should do raw, but her eyes changed color. She has a before and after, and her eyes changed. So I think the skin, it most definitely can change. Why can't it? You get your body to a place where it's thriving and you're eating right and you're exercising, you're drinking water. We know if you don't drink water, your skin's going to get saggy. But if you drink and plump up with a lot of water, the skin will plump up too. Yeah, so we can recreate. Is anything too hard for God? No, it's not. And vegetables, if you look at Christy Brinkley, she's been a vegetarian almost her whole life. She's 55 years old, supermodel, for those of you who don't know her. She's an American supermodel. And she attributes a lot of the way she looks, and I don't know if she had any work done, but she looks incredible. She attributes it to the vegan diet or vegetarian diet. Carol Alt is another one. She's raw vegan. And she looks, she looks incredible. Yeah, so, okay. So do I think? Yes. Have I looked better when I'm completely refreshed? Yes. When I sleep is the fountain of youth too. If I don't sleep, I look really tired, and that can affect your skin. But you go to bed and you get into this habit of sleeping, you're going to get younger.
Yeah, so when you're thinking about what you're putting in your body, we want to think about hydration is one of the big things. So making sure you're drinking plenty of filtered water, but it's not just water. You want to make sure you're getting good electrolytes and minerals, and you also want to be getting good fats, healthy fats. Healthy fats are really important for the health of our cells and our skin cells. And so making sure that you're avoiding the trans fats, the hydrogen oil, partially hydrogenated oils that are in a lot of packaged foods, and instead choosing more of the avocado oils and the olive oil and maybe some coconut oil. Those types of oils are going to be more beneficial, and the ones that come from nuts and seeds, and though getting more of those in your diet are going to be the beneficial oils that your body needs to hydrate. We also need antioxidants, so colorful fruits and vegetables also help protect the skin. Oxidative damage is one of the big root causes behind especially accelerated aging and also some of the inflammatory skin issues. So getting antioxidants, also you could get those in the form of a supplement as well. Okay. And so those are some of the things. I think collagen, a lot of people ask me about collagen, and people can get that in their diet from things like bone broth. Collagen is important for the structure of our skin. Collagen helps give our skin that texture and that firmness, and it does start to degrade as we age, and so we can help support it by getting foods in our diet. Vitamin C is one of the things that helps support collagen, so that's another important nutrient.
You can be suffering from a variety of illnesses that no one is aware of because they can't see what's going on inside of your body. However, an entire section of the cosmetic industry is devoted to hiding problems with your skin. People spend thousands of dollars on creams, ointments, and cosmetics to make their skin look healthier or hide flaws, rashes, or blemishes. From minor skin issues to major ailments, it is common for women and men to seek out both commercial and natural remedies in our quest for a healthy glow.
This next one, Ella, she has, Ella says, I have pemphigus foliaceus for 13 years. She's doing all these food, probiotic supplements, no meat, dairy, gluten-rich food. So a lot of these talk about food and taking L-glutamine, slippery elm, and supplements. Again, I'm going to circle back to what John talked about earlier. Have you done a parasite cleanse? Have you looked at heavy metal toxicity? Have you looked at other potential gut infections or viral infection that's triggering these sensitivities? If you can't tolerate any food, you can't even have bone broth, that means you have severe leaky gut that's not healed yet. Now you say, well, I'm taking L-glutamine and slippery elm, but that doesn't automatically heal the gut. Those are important, they help, but you may need to do more. For example, parasites or metals or other things. So again, you got to keep just listening and learn and try other things as well. For example, vitamin D3, it's not on the list. Maybe you are taking it, maybe you're not. Make sure D3 level is good. Glutathione, we talked about earlier, parasite cleanse. Make sure that you have even good brain function. A lot of people will say, oh, digestion's not good, but when we really ask, the brain function is not that good. Brain fog, can't focus, memory loss. Maybe neurologically, the brain's not able to innervate the gut. So there may be some brain exercise you need to do to get the brain to fire better or to do things to improve fuel delivery to the brain. So there's a lot of pieces to it, but definitely if you can't tolerate food, you got to look at other reasons for why you're having this problem besides just elimination and besides just taking leaky gut support.
So over the years of research with vitamin D, we're finding out that if we take D3 by itself, it can actually lead to excessive levels of calcium in the body. However, if we combine the D3 with K2, the body is able to regulate calcium levels effectively. Since both of these supplements play a key role in calcium regulation, they need to both be present to work together to increase bone strength. However, if there isn't enough vitamin K in the body and the vitamin D causes an excess of calcium, the body will begin to deposit that extra calcium into other tissues like your arteries.
This is what leads to atherosclerosis and heart disease. Eating a healthy diet is a very great way to help your heart health. But if this dysregulation of calcium is happening, you can still find yourself with a heart condition that you weren't expecting. So that's why it was important for us when we were formulating our D3 product that we combined it with K2. We want to see people being able to balance their body and get all their body systems working well and working together in the right ways. So D3 plus K2 with bioperine with Well of Life is an amazing supplement that you can take today to use to help you get the best out of life and combat these significant challenges that we face today.
So I had a patient, a woman, work with me, and she had acne, and she had it on her face, but she also had it on her chest and her back. And it was, she had pictures, and she was just covered, and it was so debilitating for her. She was so embarrassed that to go to work, to even be intimate with her husband, she was embarrassed. She said, I don't even want to go put on a bathing suit and go to the beach or do anything in the summer. And so working with her though, it took some time. And first we started to notice improvement on her face and the acne reducing on her face. When we did some testing, we noticed she had some gut dysbiosis issues, some nutritional deficiencies, some hormonal imbalances. So there were multiple layers of root causes going on that we needed to address. So when we did testing, we did supplements and work with her on that and addressing those. And so within a few weeks, she started to notice a slight improvement. And then within a few months, she was noticing a bigger difference in her skin. It was also giving her a topical I use a local compounding pharmacy, and they create customized treatments, topical treatments for my patients. And so I was using that. Of course, she's using my skincare line too. And then after a few months, then she started to notice like on her chest and her back. And there are other treatments topicals. I use a different topical for the body than for the face, because the skin is different on the body than it is on the face. Okay. A lot of times people with acne, they have noticed that, like, there was one thing will help here on their face, but they can't get it to clear up on their body. So there are some things that will help more with the body. So then when we did that, it started to improve, and then it really cleared up. And again, this takes time, but and she was patient because she knew, I see improvement, I'm going to keep going with this. And I remember the point when I did a call with her, I did a video call with her, and she had tears in her eyes, and she's like, it's kind of like, I love my patients. She had tears in her eyes because she's like, I finally feel more confident. I'm going to the beach. I'm going on a trip with my husband, and it's improved our relationship. It's not only just like the physical, but also, and it touches me too, because I remember how that impacted my life as a child, about struggling with my skin, and then I felt there wasn't any hope. And then to be able to have that change and turn around and to get your life back.
Growing up, we were taught to cover our skin imperfections or blemishes with creams. We often assume that the rash or acne is a temporary problem that will eventually go away on its own. Unless there is a family history of medical issues affecting one's skin, such as eczema, people often don't realize that there may be deeper underlying health issues that are causing their skin problems. Take the time to listen to these stories to see if you can relate to some of the following skin problems.
So what people typically do is they'll have a tendency to suppress or cover up skin issues. So instead of looking for the root cause, the typical approach in conventional medicine is use a topical steroid, take an allergy medication. So those are some of the things that were given to me for more of the eczema and those types of skin issues. But then also with acne, a lot of times people are given Accutane, or they're given antibiotics, or for women they're put on birth control pills. And this can just create more complications. But until you really get to the root cause, you're going to keep creating this Band-Aid approach where you're not really addressing the underlying cause. And also you're not giving the body what it needs to heal. And so, for example, what I see in my patients, what I've seen over the years is that if someone maybe as a child has eczema and they're given a topical steroid, or they're given just topical treatments to suppress the eruption, then later on, it might, calm down the inflammation, but later on, that child will oftentimes develop asthma because that inflammation, that internal inflammation, and the imbalances with the immune system haven't been addressed. And then maybe they're given an inhaler. And so that, again, we're suppressing the symptom and not addressing what the root cause is. Then later on, I see people develop things like autoimmune disease. So it just gets more and more complicated the longer we wait, and the more we use medications to suppress. Now, I'm not totally opposed to medications, of course. As a naturopathic physician, I will prescribe medications when necessary, but I'm really careful about when I prescribe them, and I only use them temporarily to just calm the symptoms down enough, and then really still work on addressing those root causes, things like addressing inflammation and hormonal imbalances and nutritional deficiencies, gut microbiome imbalances. Those are the things that we really want to support. When we do that, you're not only going to help heal the skin, but you're also going to help the health in so many other ways.
You feel so much better all around.
Right? And that's why I call skin our magic mirror that gives us great clues about our overall health. So instead of ignoring or suppressing the signs our skin is giving us, let's figure out what those messages are, what's behind that. And then we can get so much more information about our overall health and prevent and address different diseases.
A really good, easy test to look at fungal possibility is that you look at your tongue. Yeah? If you look at the tongue and it's coated, white, thick, furriness, Most of the time, I find that there's yeast inside the body. If the patient has athlete's feet, they've got skin, you got eczema on their skin, they've got like eczema patches, or they've got tinea versicolor, which is another skin fungus on their back, or they got some skin issues, right? That is, I look at the skin, outside skin, which is external skin, is the same as the internal. It's just a little different. The external becomes the internal, in the mouth down, nasal, sinus, lung, all of it's all related into, and the same integumentum, if you want to call it. So what I find is that there's clues everywhere. You just gotta look. Gotta look. I look at nails, tongue. I look at everything. So then, once I figure out, wow, you got some bugs, we gotta wipe them out. What I mean by that is, I don't want to say it's like an antibiotic, but we've just got to create a better balance. And that's where kimchi comes in too. Kimchi is an antimicrobial agent. It will kill pathogenic bacteria. It will create a healthier microbiome. The ability for it to really create a robust microbiome is unparalleled. Forget about, it just outshines probiotic supplements. It just does. Kimchi has over 900 different strains of bacteria. 900 different. Probiotic supplements, if you're lucky, you've got 12. Maybe you've got 24. When it comes to kimchi, it just wipes it all out. And because it's lactic acid bacteria, it's going to kill the bacteria that doesn't like lactic acid medium. That's the reason why it's been so incredibly life-changing for Korean people. Korean people, there's only 5.8% of obese people in Korea. Remember earlier I said 33 in the US, 5.8. And they don't eat well. They eat white rice, noodles, pizzas, burgers, everything. Every American shop and food restaurant is in South Korea.
Is it as bad as America?
Oh God, yes. If not, even worse. Even worse. The amount of sugar and desserts, their desserts are humongous, like huge. If you ever look on YouTube, you'll know the Korean culture. They are mega eating people. They just love food. They love making food. They love eating carbohydrates and sugar. But every time I see them, and I was there, and I realized this is what got me into writing about the kimchi diet, was because they were eating things that Americans were eating, but they were so much leaner. Beautiful skin, flat-bellied, lots of energy, even the elders.
Were they healthier? Did they have less disease?
Oh yes, absolutely less disease. So what I figured out was that they eat kimchi, at least half a cup of kimchi. Half a cup of kimchi every day. They eat, like an average person like me, we eat 300 billion CFUs of bacteria per day. Friendly bacteria, good stuff. 300 billion. When you look at the probiotic supplements, it's only like 10, 25. If you're lucky, maybe 40 to 50. Right? Doctors might use the higher levels, the high potency probiotics, but there's only a few strains there. All you need to do is make your own. You make your own kimchi, and you do that, your whole family is going to change. Your mood is changed because there's psychobiotics in there. Psychobiotics are probiotics that affect mood and your brain function, neurotransmitters, GABA. Kimchi is known to have high levels of a bacteria that makes GABA, serotonin, even dopamine. You just gotta, and they just did a research. One of the new research I just looked at was about glutathione. It makes glutathione in the brain, and they were linking about for Alzheimer's that kimchi may be an amazing food, a functional food for Alzheimer's because of the amount of glutathione that it makes in the brain. It's hard to make glutathione in the brain, because glutathione is the one supplement I use highly with all of my chronic ill patients, especially Parkinson's. All neuro patients are on it. And I use the one that's sublingual. If they can do it IV, great, when they do a glutathione push, but it's expensive. But the ones that I use, it's at high level, 450 milligrams per teaspoon. So I have them do it 2 to 3 times a day. Phenomenal for heavy metal detoxification, viral infections, any type of multiple chemical sensitivity cases. I wrap that together and I do a little cocktail before they go into the sauna. the far infrared sauna. So there's many, many different ways for you to target bugs.
Let's go into those root causes a little bit more. Hormones, that's like a big question for women. They know that it's like my hormones are out of whack, but there's actually not a lot of specific knowledge on what hormones are, what they do in our body, how they're impacting my body, but I don't know how and where to start. And I find from what I've seen just everywhere, they feel so lost. How do you address that?
Yeah, and there are so many different types of hormones too, and the interplay between them is pretty complicated, actually. It is a very important topic. It's also complex, and it's individual too. Every woman is different, and so it's a little bit different. I know I have a podcast, the Spa Doctor podcast, and it's one of our hottest topics is on women's hormones because there's so many different layers that we can talk about because for example, there's adrenal hormones, and those play a role in the skin as well as many other aspects of our health. But since we're talking about skin, cortisol is an adrenal hormone that's released with stress when we have, especially, and it goes, it can continue to be released if we don't manage our stress. It just continues and can kind of adrenals can have a hard time regulating that secretion and that function. And so what can happen with high cortisol is it can trigger more inflammation in the body. And that is another one of the big root causes is inflammation. And with skin issues, I call it skin inflammation, where you have that internal inflammation that's showing up on the skin. So really a lot of the chronic skin conditions like eczema and acne, those are inflammatory issues. And so, and it's funny with skin, we get stressed by our skin, and then stress can trigger worsening of skin symptoms. So mindfulness, stress management practices are really important. And then we also have our thyroid hormone, and that is really important for a lot of different symptoms and for our health. When it comes to skin, one of the early warning signs of low thyroid function is dry skin. So that can be one of the early things that people will notice, and especially if it comes along with fatigue and feeling kind of chilly, constipation, hair loss. There's a number of symptoms that go along with low thyroid function. And then on the flip side of that, with hyperthyroidism, a hyperthyroid function, you might notice more oily skin as one of the early symptoms of hyperthyroidism. And then we have sex hormones like estrogen, progesterone, testosterone, and those they change during our life. They change for women, they change during the month. And all of them play an important role in our skin as our things like acne, as well as aging and how well our skin ages and those changes that happen throughout our life. And so there are definitely things that we can do with diet and lifestyle. Even just the stress management part that I talked about, that is so key, that plays into all these other hormones. And so even that part of it is important. So healthy lifestyle practices. And then if you have a lot of symptoms, if a woman has a lot of symptoms, it's important to go and work with somebody. Try not to figure it out on your own, because like I said, it is complex. You could get a lot of information that empowers you and helps educate you, but you want to work with somebody like a functional medicine doctor or a naturopathic physician that can do some testing, really find out what's going on and individualize the treatment.
There are so many ingredients that we now know are toxic to our bodies. So besides what we've known for a few decades about the toll on our endocrine health and our hormonal system, now through study with the microbiome, we understand that this toxic load is actually mutating microbes and even making some microbes extinct in and on in our guts and on our skin. So that brings a whole new level of sort of seriousness about why we need to avoid these things. So we've known for a few decades about the toxicity of something like a methylparaben, which is used to preserve all types of cosmetics. That ingredient, and it can even be found in organic ingredients, it's only used at 0.01%, which is a small amount. And so there's often just like, oh, it's just such a tiny amount. But this is such a good example of how this infinitesimal amount of 0.01 methylparabens actually adds to our toxic load because, for example, when they study diseased breast tissue, 100% of diseased breast tissue also has deposits of parabens within that tissue. And so when we're applying this daily for years on end, it does take a toll on our body. Even something like applying a deodorant for a few decades. In most commercial common deodorants, they have aluminum in them. And so you've got this micro dosing of aluminum going into a very sensitive part of our body, which is really connected to the lymph nodes. Then often, women are shaving their armpits. So you've got a full opening for all those micro heavy metals to come into the body. And most people are also have a burden of aluminum in their body. So it's just like a small example of these micro ingredients that really do show up in our body. And then our systems are trying to deal with it. The great thing is it's 2019 and the banquet of beautiful botanicals and options that are available to take care of your skin and feel beautiful is like outstanding. So it's not like once you learn about this, like you have to, have a very restricted lifestyle. So it's just about going into this other realm and understanding that these ingredients are completely effective for anything you thought you needed before. There is a beautiful alternative that will add to the health of your body, which is, I think, how we want to think about cosmetics. I like to call them cosmoetics because we really want to engage with the elements of the cosmos to feel beautiful.
Yeah, it's so true. As women, we love our pampering. We love to have that process in the morning and the evenings, and I don't think we should have to give that up. I think that is it. If you enjoy it, keep doing it. But we need to be mindful of what we're putting on our skin. Mm-hmm. I think there's been this misunderstanding or just kind of maybe a blind eye to the fact that what we put on our skin actually can get absorbed into the body. And we see this when we look at tests and we see, for example, parabens, which are in personal care products. We see parabens showing up in breast tumor tissue. Wow. And we see phthalates showing up in human samples and urine samples of most people tested. And a lot of these come from the personal care products that we're using. And of course, we're exposed to toxins in our environment, in our water, and our food, and our homes, our cleaning products. And there are a lot of different ways we're exposed to it. And our personal care products are one of the main ways we are. If you think about how many products do you use every day? Start thinking about it. All the makeup, the sunscreen, the deodorant, the shampoo and conditioner, the toothpaste, all of it. Yeah. And it becomes this sort of soup of ingredients. And our bodies become this almost lab experiment. All these different things, and how are they interacting? And we do know that there is more research coming out on endocrine disrupting chemicals that are in personal care products, these hormone disrupting chemicals that can actually bind to hormone receptors and mimic or alter the way that they function. And so we really want to reduce our exposure to those. And I mentioned parabens. That's one of the places that they have estrogen mimicking effects. So what you look for is on the ingredient label, you want to avoid anything that has the word paraben at the end of the word. A lot of companies are actually taking these out, which is really great news. Yeah. But then what are they replacing it with?
That's the question.
That's part of the problem. So another big one to look for is fragrance. And anything with a fragrance, unless it is made from organic essential oils, or if it's unless it's a natural fragrance, it is likely going to contain a number of different endocrine disrupting chemicals. When the word fragrance is put on the label, they don't have to include all the things that are in it. But remember, there's a lot that goes into fragrance. One of the examples I oftentimes share with people is diethyl phthalate, which is a type of phthalate. It's used in fragrance to help the smell last longer. but it is a known hormone disrupting chemical, and it does show up in human samples. So this is one that we want to be particularly concerned of. And you can definitely find products that are fragrance free, or that they used organic essential oils instead. So I think there are a lot of options out there now, and I think those are two good places to start. But I also want to talk about sunscreen, because that's another big one that we're using, and we're doing a good thing. We're trying to protect our skin from sun damage and protect from skin cancer. But the problem is that a lot of these sunscreens have chemicals in them that have these endocrine disrupting chemicals. For example, oxybenzone is an ingredient in a lot of sunscreens. And again, it's one that's starting to be pulled out, so that's a good thing. But be aware of these ingredients and start looking at your labels. And there are great resources. I talk about them in my book, Clean Skin from Within. I talk about 20 different ingredients to avoid, and the research behind that, and then alternatives to those ingredients. There's also things like Environmental Working Group, EWG.org. They also have a Skin Deep database and verified skincare products and things that can be great resources for people to start, because I know it's overwhelming.
Yes.
But if you just start with the things that you use every day.
Yep.
Because I know you probably have a lot of things in your bathroom and maybe in your purse too, but think about the things that you use every day, because that's what your body is not getting a break from. Exactly. Our bodies are really wise, and it's able to eliminate a lot of the toxins that we're exposed to. But when we're constantly we don't give our bodies a break from it, that's when it becomes a problem.
When I started eating more fruits and vegetables, it's like that was like a natural fountain of youth. I started looking better and younger. In fact, I remember looking when I was 24, and I was so bloated. My face was so swollen, and I had like this gray ash to my skin. And I had really low vitamin D. And once I started walking and just getting sun, they always say, don't use sun because the sun is gonna like completely age your skin.
I can tell you get sun.
Yeah, I get sun because it is healing my skin. My vitamin D was 22 when I took it, and that's really low. And I took it about 2 months ago, and now it's at 78. Not supplementing, just walking and getting that sun that's so precious to us in terms of healing, getting that vitamin D. And so no, I don't do those things. I think natural food is the fountain of youth. When we eat the way we were intended to eat, let food be your medicine. Let food be your Botox.
Yeah.
But we live in a society, and sun.
I've never heard somebody say that they use the sun to make them look younger.
Yeah. Isn't
really?
it wild?
You're not kidding me?
I'm not joking. I go out in the sun every day.
And you're not like setting the time watch 5 minutes only?
I just walk a lot.
Yeah.
And I don't worry too much about getting, everyone, it's like, oh, it's going to age you. And I think vitamin D is not, it's anti-aging.
Yeah.
So
one of the things that I've thought about, I'm yet to research some more, I'm looking at the systematic nature of it, because if you do everything else wrong, like if you're having very poor nutrition, you're exposing yourself to a lot of sun, it makes me wonder whether that's what causes the problem.
Yes.
And so I would bet on it personally.
I agree.
Yeah.
And then lathering.
You're an example. I mean, you don't have cancer.
And lathering that sunscreen on is not helpful. It's mostly petroleum-based product. So you're like trying to get sunshine through that petroleum-based product. And we know that our skin is like the largest organ, and we know it absorbs things. So you're putting those toxins on your skin. We shouldn't blame the sun for that. And I'm not saying too much of a good thing. We don't want to go burn ourselves and be constantly drinking gallons and gallons of water. You could die from doing too much of that, right? So we talk about temperance. Be mindful of not too much of good things and avoid the bad things.
Wow, that's interesting. That seems to take discernment sometimes, because nobody can tell you exactly how much sun you should have.
Yeah.
Your body's a little bit unique, and so is mine, and so is somebody else's. So like expert consultation, knowledge and information is provided to you, and prayer, God, which one's for me?
Amen. Absolutely.
And then,
definitely.
Yeah, because somebody maybe should limit their exposure a little more than somebody else based on needing to clear up another issue. But typically, once we get good and on the right path, then we can be a little less restrictive with good things.
Well, I feel like we know a lot about, for decades we've known about the toxicity of toiletries and its effect on our skin and cells and hormones. So before we think about what wrinkle cream to use, it's like we got to step back and think of like the basics, like can our skin breathe? Are we showering in water that's at least filtered from the fluoride and the chlorine and all the ingredients? Are we engaging with what's been grown in the earth? So what's really pouring out of body care bottles is really without vital fluids, without life force, and really it's missing the essential elements that have interplayed with earth and all that sort of stuff. So what we want to apply to our skin, really, we should hope that it has emerged from soil and, been in the sun. And our bodies too, like our skin is literally designed with thousands of vitamin D receptors, designed to receive sunshine. So, in this culture, we really, we have sort of like culturally rejected the sun's sustenance, but we really do need sun rays to, if we deny the sun, then we are draining our innate immunity. And on a deep level, we are drying out our skin from the inside because the interaction of sun on skin really creates what we call vitamin D, which is more of a hormonal precursor, and it activates really important types of cholesterol, healthy cholesterol in the body, and like lubricates us from the inside.
Excellent, I love that. Nadine, I'm curious, the sun seems to have a negative impact on a lot of people, but I'm curious as to whether they're doing something else that's causing that issue. Is it a nutrition issue that they're combining so their body's not equipped when they're going into the sun? Is there a hydration issue so their body's not hydrated so the sun becomes damaging to their skin? Is that at all true from your research?
Yes, I feel that is. So definitely, repeated sunburns are not ideal, and we want to interact with the sun wisely. But interesting to note, like our skin and our DNA can deal with a sunburn like physiologically a lot easier than it can being all day in the sun with sunscreen. So on a DNA level, but then so we always think about like what the sun's doing to us, and we really want to think about what are we bringing to that relationship, right? Because we're always in relation to creation every second. So there's this interaction, and our skin was designed for that interaction with the vitamin D receptors. But if we offer the sun bodies that are dehydrated from diets of like cola and soda and a lot of coffee, those are all very dehydrating. Water that's filled with like 300 chemicals in city tap water. If we're bringing a depleted microbiome to that, if we are eating a diet high in rancid oils, all the polyunsaturated fatty acids, the mazola, the canola, the corn, the soy, that's really quite, those are really quite the culprits for age spots, melasma, hyperpigmentation, are things like birth control pills and the PUFA oil, the PUFA fatty oils, and then also just a diet of processed food. And then we're washing repeatedly with surfactants, which leave micro splinters in the stratum corneum, and then we're baking in the sun with sunscreen. That's the combination that really creates sun-damaged skin. So we want to bring to the sun like the synergy between like good fats in the body and chlorophyll, because the sun, this is really our cosmic pollination. That's our photosynthesis. I was like, what's that word? So we want to, juice up that way. Well, can I just wear sunblock and take vitamin D supplements? And it's like, yeah, but no, like you need like at least do both, because the vitamin D, the supplement is a fat soluble vitamin D, but the one with the sun is water soluble, and it's purifying your blood. It's interacting with your microbiome to nourish it and produce antimicrobial peptides, and like it just can go on and on. Also, what we're bringing to the sun, studies showed, and this was in the Lancet, and it was a while ago. It was before all of the workforce was sitting in front of a computer screen all day, but it did show that people that generally worked outside more and spent more time outside had about I can't remember off the top, but it was either 25 to 45% less chance of getting melanoma than people that would go outside sporadically and worked under fluorescent lighting all day. It was those people that were, so it's not even about outside. The conditions that can create melanoma, are often thought to be more fungal.
But there's this whole other world, and I'd like to be your spokesperson for going upstream. So we've got the snapshot of where you are right now. Let's say you're fatigued and you have brain fog and you can't enjoy the kind of activities that you used to enjoy. So the first reflexive action is there a pill? Is there a supplement? Is there some kind of medical treatment that will restore my health? Possibly, but usually it's not that quick. There isn't a solution that will instantly fix wherever you found yourself ending up. The most important thing to consider, besides the patches to put on those symptoms right now, is can you take your little canoe wherever you are, you're seeing like a jungle, and can you start to paddle upstream a little bit? And if you went upstream, can you see some of the health behaviors that may have landed you where you are in that jungle swamp? Can you start to discover some of the environmental factors? Were there things that little by little you've been exposed to? Were there things in the air, in the water, in your food, in your personal care products that may have been building up in your system little by little by little as you're floating downstream? So maybe you didn't take an active approach. Maybe all this happened to you passively, and you ended up where you ended up. But now, can you actively seek to find out what got into your body or what health habits accumulated and got you where you are so that you can start to undo them? So there are these two sides. There's the downstream, wherever you are now, which usually needs diagnosis, treatment, yes. But to truly make your health condition disappear, to actually dissolve your symptoms and your body to fix itself and go back to functioning the way that it did, you have to kind of undo whatever got done over time. So paddling upstream, maybe you figure out, oh, there were some products I was taking that may have had some contamination with heavy metals, or the indoor air, I was using a lot of fragrance products, a lot of new building materials in my remodeled house, and maybe those started to affect my brain function or my body function. And I was eating out a lot, so I'm not sure if there were pesticides in the food, or my next door neighbor was spraying some strange things, their house was tinted. And you start to little by little do your own detective work to figure out how you got to where you are.
We are so conditioned to putting creams and lotions on our skin that we rarely stop to consider what's inside those bottles sitting on the store shelves. It's often assumed that if it's sold in a drugstore or by a well-known chain store, that it must be considered safe. But did you know that the aluminum in your antiperspirant can block your skin from expelling toxins that has been linked to Alzheimer's? People give little thought to the safety of over-the-counter products and commonly prescribed medicine, such as antibiotics or birth control pills. It's important to realize the potential danger of any medication that we put in our bodies and on our skin when trying to treat skin ailments.
Similarly with antibiotics, a lot of people with acne are put on a number of different antibiotics. And I think that dermatologists are trying to get away from doing more as much. I think doctors in general are trying to get away from using so much antibiotics because we realize that it can actually create imbalances with the gut microbiome. And that can create more health issues, including more skin problems, because that's one of the root causes for skin issues. But Unfortunately, what happens is usually by the time people come to see me, they've already been through taking all the antibiotics.
Yeah.
And they have got dysbiosis issues, and we have to address those. We have to fix those and repair all the damage that's happened because they took the antibiotics. Maybe they got some relief, but as soon as they went off, the acne came back. So they still have the problem, and now they've got another issue to deal with. So I think one of the problems with medications is they come with side effects, and some of them are temporary, and some of them have long-lasting effects. Yeah, I mean, I think one of the big ones that concerns me, one of the big medications is Accutane, and other versions of that medication. It comes in other names. It comes with other names too. It was actually pulled off the market years back, but it's back in other names. But the concern is that it has some pretty serious potential side effects, and those include birth defects in the offspring of the woman who might be taking it, and also it can create problems with depression and mental emotional issues. And so I know that doctors oftentimes they should, and they're supposed to screen people, especially women, to make sure that they aren't at high risk for that. But I still continue to hear stories about people who said, I didn't really struggle with depression. It wasn't an issue for me. But when I was put on that medication, I felt terrible. And here you are already struggling with acne when it's moderate to severe acne is debilitating condition. It really impacts not just physical, but also on an emotional level. And people are already having a hard time. And then to have that struggle on top of it can be really hard. And then I certainly have heard stories of people saying, I took Accutane and my acne cleared up and I was so happy. But then they go off of it and it comes right back. Or sometimes it's even worse when it comes back. So again, you're not really addressing the root cause. It becomes this Band-Aid, it becomes a crutch. And you're not really giving your body the tools it needs to heal. And eventually, and this is why I just want people to know this, because the sooner you realize this, the better you're going to be, because I see it all the time where people, I wish I had never taken that. And now I have to go back and fix all this.
We may still choose a little blemish cover or foundation to deal with the occasional acne flare-ups as we continue on our healing journey. But to be truly healthy, it's time that we looked at the body as a whole, both on the inside and the outside. Diet, hygiene, supplements, stress reduction, and certain natural medicines all play key roles in healing the largest organ of our body. When you make the right choices and choose to live well, your skin will reflect your healthy glow.
But it's also nice to be able to do certain foundational things. And again, that's why I wrote my book, Clean Skin from Within, to give people tools to use in that 2-week plan. I go through foods to eat and all kinds of things. So I broke the book down into 4 different categories or sections. And so I think it's important for people to know what those are, because they're clean plate, clean slate, clean body, and clean mind. And really you want to address all of those components. They're all really important. So the clean plate are the foods to eat or the foods to avoid. And I think that's a great place to start. That's a really important part. I think that the inside out approach to skin, that's probably 80% of what you need to do. And that's what I find, especially with chronic skin issues. And then the other 20% is what you're putting on your skin. And usually people think of it the other way around. They start with putting stuff on their skin, and then they start thinking, okay, what else can I do? So I want people to think of it the other way. And then the clean slate section is about the products that you're putting on your skin. And you want to be sure to avoid hormone disrupting chemicals that are in a lot of skincare products, and instead using clean, natural ingredients, natural actives that actually help support the health of the skin. And there are things that you can put on your skin that actually help the skin microbiome. And then we have clean body, which is about other things in our environment. How well is our liver and kidneys functioning to detox the body? And are we exposed to toxins in our environment that can be further disrupting hormonal imbalances, creating nutritional deficiencies, and a number of other of the root causes. And then we have Clean Mind, which is about mindfulness and stress management practices. I talked about the importance of that when it comes to hormone balance. And our peace of mind and managing stress is a key part of that.
What happens when people don't get enough essential fatty acids, the symptoms that show up that you could call essential fatty acid insufficiency or deficiency include all kinds. Dry skin is one of the first, because skin gets them last and loses them first, because life gives the inside of the body priority on the oils, because your vital organs, you can live with dry skin, but you could not live with a dried out heart. So your skin dries out before your heart does. So there's a priority of how the body gets its nutrients. But you'll have less energy. Your skin will be drier. You may not be able to think as well. Your concentration may not be as good. I've seen people who claim to have attention deficit. When they started taking oils, their attention span increased substantially. You build muscle faster and you hang on to the muscle longer once you stop exercising. Your stamina in both strength and endurance sports goes up by 40 to 60%. The omega-3s are very good for decreasing inflammation. So you have less pain in joints and less swelling, less water retention. The omega-3s turn on fat burning in the body. I call them the fat burning fire starter. They make hair and nails grow better. And at one point we wanted to sell it through spas and hair cutting salons, because we said, hey, if you convince your clients to use the oil, they have to come back 25% more often, because their hair and their nails will grow that much faster. And so you don't get a lot of the hair problems and the split nails and all of that kind of stuff. You get that much less. One of the reasons why they're so good is they increase the body's ability to use oxygen. So they increase oxygen metabolism, and that increases energy level. That's why they increase energy level. They make hormones work more effectively at the cell receptor level. That means less hormones will get you the same result. So that means both the glands can work harder, but also what they make works better, so you don't need as much. They decrease most of the major cardiovascular risk factors. So they make platelets less sticky. They can lower high blood pressure. Now, not always, because if your high blood pressure comes from lack of magnesium, then you need to take magnesium for that. Because omega-3s will only reverse symptoms that are caused by not getting enough omega-3s. That's the way, it's very specific. Because you always have to address the cause. This is not like a magic cure for everything, because deficiency of essential fatty acids is not the only thing that is wrong with our food supply. So what else do? They relax arterial muscle tone, so they help to lower blood pressure. They decrease CRP, which is an inflammatory cardiovascular risk factor. So fundamentally, they're lowering all the major risk factors. They make you more insulin sensitive. So type 2 diabetics make insulin, but the insulin's not working because they're insulin resistant. Well, omega-3s make you insulin resistant. And the truth is that in diabetes, the insulin resistance is at least as much a part of not getting enough omega-3s as it is getting too many sugars and starches and saturated fats. So what are we missing? People's vision has improved. There are some people who get color in their hair back. That's obviously not my case, but there are people whose hair color has come back, or partially come back. So these are all general symptoms. And then when it comes to women's health, they're extremely important in pregnancy. And the reason for that is that omega-3 and 6 are both very important in brain function, and both are essential. And so they have to be brought into the mother's diet, and from the mother's diet into the baby. Now, in the brain, the essential fatty acid is actually very low, and the essential fatty acid derivatives, especially DHA, is very high. Women are very good at converting the essential fatty acid into DHA. Much more effectively they do that than men. And that's because men never get pregnant, so they don't have to, during pregnancy, feed their own brain and feed a brain that's developing in their body. So very important for women. And the research says that women get depleted by their children of essential fatty acids. Each child depletes the mother further. Each child gets less than the previous child. And they think it's the reason why women get 2 to 15 times more chronic fatigue, fibromyalgia, collagen diseases, inflammatory diseases, autoimmune diseases, and depression than men do. And they say it's because of the depletion of the essential fatty acids during childbearing that they are depleted, and why they get those conditions so much more frequently. And their suggestion is that women need to make sure that they have a reliable source of both essential fatty acids in their diet, both for their own health and for the health of their children. I think that's a pretty good summary. You know, everything else that we talked about, of course, applies to both women and men, but this is specifically applies to women. And they need the essential fatty acids more than they need fish oils that are damaged, because the essential fatty acid, if it's not damaged, their body can do the conversion and does it quite effectively. 5 to 10% of what they take in is converted.
To really think about what your microbiome needs, I like to think of it with 3 steps to evolve and care for your body. That's stop, seal, and seed. So with stopping, it's about stopping the practices that are affecting our microbiome in a negative way, like showering in chlorine, like applying petroleum lotion to your skin, like using alcohol mouthwash to rinse your mouth. So all of these things are going to mutate the microbiome. For women and vaginal health, you want to reconsider using like classic tampons that are filled with dioxins and different chemicals going right up into the apex of your being with very thin tissue, bringing all that toxicity into the bloodstream. So it's about stopping these things, just sort of looking around your universe, your bathroom, your kitchen, and just, making some different choices. Not brushing with sodium lauryl sulfate for your teeth, that kind of thing. And then seal is about sealing and healing the skin, or sealing and healing the guts, sealing and healing the skin inside the mouth if you've got bleeding gums. So that's where a lot of botanicals come into play. If we're thinking about the mouth, that would be, brushing without something like sodium lauryl sulfate, which will make the gums bleed more. Even mercury fillings cause gum disease, which make the gums bleed. And not rinsing with alcohol, which most commercial mouthwashes are made with a synthetic alcohol, which the studies show that it creates about or above 36,000 cases of mouth cancer a year. So those are the things we want to stop. And then we want to get the integrity of the skin going, or the gums, or whatever area needs to be become healthy tissue again. So for our like face skin, for example, you would stop doing like chemical peels or over exfoliating. You want to recover that top layer, the integrity of the stratum corneum on the skin. And then we're bringing balance back to the microbiome instead of making our skin sort of go back and forth with this vicious cycle every day where we're soaping it up with surfactants and then scrubbing it clean and exposing the young cells too early, and all that modern beauty practice, which is really causing damage to our skin. And it may not show up right away. It could just be long-term stress, long-term inflammation that can lead to things like melasma or hyperpigmentation. And all of that has to do with the integrity of that top layer of the skin. So using things like botanicals, so instead of using soap to wash your face, there's really no part of the body that needs soap. You want to use it for your pits and bits and scrubbing your hands and obviously your nails. But those sort of that vision of those old soap commercials where they're like totally lathered up in the shower in their arms and legs, that is not needed. There's no point where your thigh or your forearm needs to be washed with soap. So you want to allow that to just be, hopefully you're having, obviously you're having baths and showers or being in the sun, and all that will keep the skin clean. And then to wash our face, we want to ditch the soap. We don't want to scrub with surfactants and get that squeaky clean thing. That's a modern myth, and our skin rebels at that. So for cleaning the skin, you want to ditch the soap and use oil. Not any oil, not petroleum oil, not almond oil, not rancid oil, but oil like something like jojoba or olive oil or coconut oil, which have been used for thousands of years to take care of the skin. And that will gently cleanse and lift dirt out of the pores, and it helps the lipid barrier. It helps the integrity of the top layer of the skin. What they now know with studying the microbiome is that microscopic splinters are lodged into the stratum corneum every time the face is washed with soap or even their mild foaming cleanser. And these microscopic splinters do not leave the skin when the skin is rinsed. So you're getting a buildup slowly but surely over the years of washing with soap. And that can lead to long-term inflammation, which affects the skin's microbiome, which could lead to acne or rosacea. So we just want to, seal the skin by using oil, ditching the soap, not over exfoliating. And so that's an area that we can seal, working with the gums, working with botanicals on the gums to bring back more circulation to the area. We make some dental serums that, if people floss and that causes bleeding, you want to take care of that because you don't want that leak in your mouth, so to speak. And the serums are so effective. It's just such a good use of botanicals. It's like things like neem and frankincense, clove, cinnamon. And people apply that to their floss, and the bleeding gums for many people will stop in 24 hours. For some people, it may take a week to get the integrity of the gums back, but it's really fast acting. Because also the tissue for the gums can heal fast given the right environment. So we want to create the right environment for our microbiome because we're really just hosts to millions of microbes. We're just teeming. We're a tapestry that's like teeming with microbes. It's kind of freaky, but there's like a whole ecosystem that's alive on us, and we need to care for that. So then the seeding is when we reseed the body. We want to think of our bodies like this bacterial bank account, and we want to have like diverse investments. And so we need a wide variety of beneficial bacteria to help our body function, because the microbiome, we now know, science used to think it was very, cellular, that all the processes were more cellular, but now we know that the biome, the bacteria, is pretty much like, it's like right up there 50-50 with the cells. So the whole life of the microbiome is just as important. And so we can reseed our bodies because through modern lifestyles, we've lost species of microbes. So just like the planet has lost species of animals are going extinct, we've lost species of our little miniature microbe life on our bodies. And so we need to bring back the diversity, and we do that through food, eating a fermented food, sauerkraut, kimchi, and we avoid things like GMOs and glyphosates, which literally mutate and make extinct different microbes in our body. And, through probiotics, prebiotics. Prebiotics are, foods that feed the probiotics. And so that gets things going. And then specifically, you can care for the body with some probiotics too. Like you can swish with probiotics. You can put that in water, swish it around your mouth and repopulate the area. You can use honey as a cleanser or as a mask, which has a lot of enzymes and prebiotics. And so we got to keep remembering all the creatures in our body and how we're going to take care of them so that they can serve us.
Tell me whether this is correct. If you for 2 weeks stop drinking much water, so you're just drinking a cup or two a day, like most of the American public.
Yeah.
If you started getting 5 hours sleep a night, going to bed at 1 a.m. or midnight plus, if you started eating like a lot of meat, 3 times a day or something like that. If you did those things and shielded yourself from the sun, so you're no longer getting that kind of boost to the mitochondria or whatever, what do you think your skin would look like in 2 weeks?
It would definitely be more ashy. It'd dry out.
Yeah.
You'd have the elasticity wouldn't be as plump.
Yeah.
The collagen would probably be less. I know when I was in college and I'd be pulling all-nighters, I would drink Jolt, which is caffeine, just to be able to study. My skin looked so rough the next day, and I'd have bags under my eyes from lack of sleep and lack of really drinking properly and sleeping and eating right. Yeah. But then you give yourself a recharge and you feel great. Your skin is, one thing I noticed on this diet is my eyes are brighter. The whites in my eyes are brighter. And I remember when I used to eat meat all the time and I used to drink dairy, I'd have a lot of blood vessels in my eyes that were just kind of in there. And so if you can change your eyes, you can change your skin. You can change internally. I know people who've reversed diabetes in 3 days. So if you can do it on the inside, you absolutely can do it on the outside. It just takes time. It takes consistency and getting your body to trust you again.
Yeah.
Our body will protect itself. If it realizes we're putting it under stress, how's it going to respond? Or more cortisol. We need to release more, hold on to that fat because she's going into starvation mode or something, right? The body will rebel or try to protect you in a way. But if you just are consistent with this journey, do it every day and just make it your goal. Don't care about what the scale says. Just make it your goal to be healthy every day. Don't starve yourself. And your body will respond and will treat you the way you're treating it.
So choosing skincare products that are clean and made with natural and organic ingredients is really important. So you can avoid those hormone disrupting chemicals and even carcinogenic ingredients that are in skincare products. It's also important to remember though, just because it's natural doesn't mean that it's going to work. So you also want your skincare products to do things for you. And that was one of the things that my patients kept telling me when I was talking to them about, make sure you're using natural skincare products. And they would say, but Dr. Cates, they don't work for me. And so I started to, back when I started hearing this, I started to dig into the research and think, why aren't natural skincare products working? Because I know the healing powers of nature. I know there's some positive research. So what's going on? What is missing? And so I realized that there are 3 things that are super important when you're looking for natural skincare products. For first thing is they really do have to be clean. A lot of times products will call themselves natural. There's actually really no regulation around hypoallergenic or natural, these claims. They're just marketing claims. There's really no regulation around that for the most part. There is some around organic, but you have to really look at the products and make sure they truly are clean. And then the second thing is you want the natural ingredients to be active. A lot of times skincare manufacturers will throw in an ingredient, say it contains CoQ10 or it contains vitamin E or argan oil, and they're using that again for marketing, and there's not actually enough of that product, or it's not in its pure form enough, and supported by other natural actives to actually make a difference in your skin. So you want it to be natural actives, so quality, quantity of ingredients, just like you'd want for your food or your supplements, you want that for your skincare products too. That's another big key why some of those natural products seem like they would work, but they don't. So the third thing a lot of people I think don't know about, and that is the pH of skincare products. Our skin, one of the biggest functions of our skin is to act as a barrier to the outside world. So it has this a mild acidity, this acid mantle that protects it from external invasion. And so when we're using skincare products, we actually want to use products that have a lower pH. The ideal pH range, this research shows the ideal pH range for skincare products is 4.6 to 5. And a lot of skincare products are actually over 5. And some are even much, much higher than that.
You know, but I get it. I get the pressure. We're deep in like consumerism and comparison, and like what you see on TV or in a magazine, which is what you're consuming all the time, is completely photoshopped, or the people have had surgery or Botox, or they're wearing a few millimeters of foundation. And you know what I mean? So we're seeing that, and it's throwing us off big time on a huge level. And that's how women in our culture are raised, like with all this going on, and it's getting younger and younger, you know, where we're getting eating disorders and girls under 10, and, you know, plastic surgery for wrinkles in your 20s and Botox when you're 18, like all of that's happening. So it's pretty thick out there, and it's a lot to navigate. And then social media just adds a whole other layer, because then we have Instagram filters. So there's a lot of perfection that is not realistic at all. And then of course we can't help but compare ourselves to that. And then, so that's like a whole situation. And then, I think you're right. And then we've eaten strange things and processed food, and things like birth control pills and antibiotics. And so why do we have all those parasites too? Like, is it because we really have depleted microbiomes? Because studies show that we are probably missing about 1,000 species right now. So the average American, so this is like we have billions of bacteria and microbes in our body, but for species in the gut, they estimate that the average North American person should have about 2,400 species. And looks like our guts are about 1,400 right now. And so what we also know, like the microbes that cause cavities are in everyone's mouth, which is like streptococcus, excuse me. And the microbes that cause skin imbalances are on everyone's skin. But when we're missing, or like H. pylori, it's like actually, you know, a few decades ago or a few centuries ago, it was okay because we're now missing our ancestral bacterial buddies. So, you know, it's the other microbes that are supposed to keep the pathogens in check. So the pathogens float around in our bodies sort of freestyle like phytoplankton, but when they grow in numbers, they gain traction. And so that's when they start to do quorum sensing, which is when they get to express their genes more, and they get to communicate, and they're like, come on guys, let's go here. And then they kind of get a gang going, and they make the biofilms, and then, you know, they're pushing out the friendly bacteria. And so what's interesting, that brings up essential oils, because with things like antibiotic resistance and the study of the microbiome, because it's like serious research now, while we may be really overusing antibiotics, there are, you know, branches of medicine and science that are concerned about that, because antibiotic resistance is a reality on many levels, from, you know, factory farming. Not that I want that to exist, but it's causing, you know, the antibiotics aren't working anymore, and they're not working on us anymore. So researchers are looking for quorum sensors, things to inhibit quorum sensing. So it's called the QSI. So the quorum sensing is when the phytoplanktons get to express themselves and gain traction and create biofilms. So they want to prevent that. And as it turns out, one of the best substances as a group is essential oils, because they are able to eradicate pathogenic bacteria, clean them up. And again, it's varying. It depends which one and which microbe, and how's cinnamon reacting with strep in a petri dish and all of that. But they all, to some degree, inhibit quorum sensing while working with the friendly bacteria. So it's much in the same way that they protect us, like they protect the plants. So they defend against pathogenic bacteria while befriending the friendly bacteria. So it's really great. And now I feel like we have the modern science to back up why people have been using things like frankincense, cloves, cinnamon, rose, peppermint, cardamom in their oral care for years, for thousands of years. So it's just a neat moment in history where we're getting a lot of studies on essential oils through this avenue of antibiotic resistance and QSI.
Why are your hormones so out of whack? Yes, you go through a monthly cycle, but so do men. We are on a monthly, everyone is on a circadian rhythm, everyone is on a monthly cycle, and your skin regenerates every 28 days. We are on a monthly cycle. You obviously see it in a different way through your menses. It's a physical reminder, but men on a much more minor level, us too. And so why are the hormones so erratic? A lot of it has to do with this. We talked about the stress, the anxiety, the food, and other things. There's so many other things you can use essential oils for. Mm-hmm. And we've talked a little bit about allergies and just having healing balms. My wife has what she calls a skin healing serum, which you would add 2 ounces of aloe, 2 ounces of coconut oil, and you use, depending on what you're trying to accomplish, several different drops of essential oil, and you buzz that up in like a Ninja or a Magic Bullet or something like that, and it creates a nice healing salve. And so for people dealing with allergies, just to help your body soothe any sort of allergic reaction, you mentioned hives earlier. Lavender is a great one. Frankincense and helichrysum and tea tree, you combine that together, it's a very strong healing serum that helped my father-in-law cure himself of skin cancer. Yeah, and anyone we've seen with rashes, with hives, with psoriasis and eczema, it's a wonderful, wonderful way of approaching that. And again, don't forget the 1% to 2% dilution we talked about earlier. That would be 6 drops of essential oil per 1 ounce of carrier oil. Just kind of do the math in your head, depending on how much carrier oil that you use. And then you can increase or decrease that dosage depending on what you're dealing with. Because if someone's dealing with like I actually had a second-degree burn on my skin, I'm not going to put a stronger dose, right? I'm going to use a very light dose of essential oils to soothe first, and then you could add stronger when you need that, because more isn't better. And that's something people need to realize. Sometimes less is more when it comes to essential oils, and 1 drop goes a long way. And allergic reactions when it comes to internal, like histamine responses or food interactions, lemon, lavender, and peppermint is a great combination. Even diffusing that throughout your home during allergy season, putting a drop of lemon, lavender, and peppermint in a gel capsule and filling that with coconut oil or olive oil and taking that twice a day has helped many people that we've been able to recommend this to help with their seasonal allergies.
Perfect example is one of the most famous stories of an individual who was working and he burnt his arm. Now we're not talking a mild burn; we're talking literally major, first-degree burns. And then on top of that, there was second-degree, then it was third-degree burns. And he looked at it and he said, "What am I going to do?" Well, he knew the property of lavender, so what did he do? He put his hand in there, and the lavender began to heal it. I remembered that story in the back of my mind several years ago, because I always tell everybody, any physician or any doctor who will not treat himself is the same as he would treat his patients. There's something wrong with him. So what I did is, I was on a ride. I was riding a motorcycle in the Caribbean islands, and I was riding a motorcycle and went to turn a corner, and their traffic laws are different than ours. And so when the group went to go this way, a tourist did not understand it, and they began to turn straight into us. So I laid the bike down sideways, and it burnt the side of my leg. Well, immediately, I knew what to do. I reached in and put lavender oil on it. and right on the burn.
Was it a bad burn?
Bad. I mean, it was blistering and it was almost to the bone. I mean, I could actually show you the scar. And so I knew immediately what I had to do. So by the time I got back into where I was at and I went in there, I had a guy go look at it. You know, I had the shift doctor look at it. He looks at it and he goes, "When did you burn this? A couple of days ago?" I said, "No, a couple of hours ago." So it's very effective and very fast. So lavender is very, very effective in its ingredients and its constituents for burns. So there are hundreds of things. So learn just something simple as burns and lavender oil.
Did it heal up better?
Oh yeah, it healed very quickly, scarred less, because it was very good for the skin, because lavender is good for the skin. It's an antiseptic, antibacterial, antimicrobial. So it had multiple benefits. And I did it without any outside interferences.
So we can think about that, but also we just think about like, how am I going to take care of my skin on a daily level? You can with like this beautiful like monoterpene medicine, but you just include it. Like you're like, I'm going to get out of the shower and then like, work these things into my body as just part of my daily care, because we can really think of like activating our skin and being a partner in its immune system instead of like, I just have to, take a normal chemical cream and I just feel like the whole microbiome's like, no, because there's so many systems in our bodies, and we our skin's really wonderfully woven with immune specific cells that alert our body of exposure to toxins. Like every minute of our lives, that's working. And then it secretes, these immune specific cells secrete antimicrobial peptides along with TNF, which is a tumor necrosis factor. So we've got these natural skin cells that are already doing that, defending against viruses and tumors. But then, this big hand comes along with like a glob of petroleum-based cream and is like, So yeah, the sea buckthorn ever is just, I like to simplify things because I like to make beauty as effortless as possible. This can be applied to the skin after the bath or shower. You can use it to wash your face. I really recommend cleansing with oil because studies show that washing with surfactants actually lodges it's like microscopic splinters into the strata corneum, and it stays there even after rinsing, and that can result in inflammation and irritation. Washing with oils is ancient, along with being kind of revolutionary, and it doesn't feel greasy. I mean, it may sound strange, especially if you have acne, but it really isn't oily when you're using authentic, organic, fresh pressed oils like jojoba or something. So there is jojoba in this. So you can use it to cleanse your face. Men can use it to shave. You can use it to remove makeup. You can use it for baby massage oil. You can put it on after you've been in the sun. So there's a lot of benefits to this one beautiful bottle. These are things that you can when we rethink of like how like skincare architecture, then we can look at different groups. So when we're, hydrating our skin, it can be with spring water, instead of using like an alcoholic face toner. Or you could use like rose water or frankincense water, or diluted apple cider vinegar is really good for harmonizing the pH of our skin.
Great.
It's got to be diluted though, it's going to sting. Sandalwood's coming to mind. It's so beautiful for scars, and studies were done. And if there's a study, it is quoted in my book of who, where, what, why. The alpha santol and beta santol in sandalwood has been shown to inhibit cells from going down a malevolent pathway. So it helps them from going abnormal. And it's really good to just put on skin blemishes that you're like, what is that? It's also glorious for arming our armpits with beautiful aromas because it has phytohormones that are similar to our armpits hormones. And so it makes the best deodorant, just like one drop each armpit, really awesome. Vetiver is really good for drying skin. It's also good for using as a deodorant. It's from a tropical grass, from the root of a tropical grass. So it's this gorgeous earthy aroma. It's lovely on men. And our distiller also grows it as part of a topsoil erosion program. So it's really good for helping areas of the earth that need that netting. Rose is gorgeous. So there's Rose Auto, which is a steam distilled essential oil. That's the type of rose that you want to use in skincare, oral care, and sort of it's more medicinal. It's actually almost as potent as clove oil, but you don't think of it sort of as astringent because it's this beautiful flower. And then if you see Rose Absolute, that's a different type of distillation, and those are generally reserved for perfume. And that has more of the classic rose aroma. So it's good to always know that difference.
And some things to look for, if you have a bar soap and it lathers up, that lathering means it has to have a higher pH in order to do that. So the sudsy, the foamy kinds of cleansers, those typically are too high of a pH to support the natural acidity of the skin. So a lot of cleansers, what people will do is they'll have a cleanser and then they'll follow with a toner that restores the pH, the acidic pH. But you really want that to start with the cleanser and the whole system to have that natural mild acidity. And so one of the questions I get asked a lot is, how do you know what the pH of your products is, right? I knew. It was right in your face. So for my company, for the Spa Doctor products, we put the pH on our website. We have the pH of the products and they're in that 4.6 to 5 pH range. One side note though is anything that's 100% oil does not have a pH. You cannot measure the pH of an oil product. So for our oil product, we don't put the pH in that because it doesn't have a pH. But that's still, as long as they're plant-based oils and they're natural and organic, that's going to help support the mild acidity of the skin. But what you want to do is just get pH strips. Simple pH strips. You could put some of the product in your hand and add the pH strip and watch and see match up to the pH meter and see what is it. It should be in that 4.6. It should be in that 4.6 to 5 pH range. It's a simple thing to do if the company is not sharing that information on their website. And I can almost guarantee that majority of the products out there, especially cleansers and body moisturizers, are 5.5 and higher. And so it's not really supporting the skin. And when in an ideal state, our skin would just kind of rebound. But if we're constantly using these products, and even water has a pH of 7, and that isn't enough to help support the mild acidity of our skin.
Wow, it's so interesting. Yeah. Did not know that.
And this mild acidity, one of the things that helps with is the skin microbiome because it provides that environment. It's almost like taking or eating prebiotics that help support the growth of good bacteria. You're having that natural mild acidity of the skin helps support a healthy skin microbiome.
Then there's the chamomiles. They're so lovely, and there's many of them. There's the blue oil of chamomile. Also in the blue oils, we have yarrow and blue tansy. Also the Latin name for that is Tanacetum annum. And those 3 oils are really high in chamazulene and there's sesquiterpenes. So anything that has esters and sesquiterpenes is really soothing and smoothing. And it's blue, so you can kind of remember that, like cooling, smoothing, soothing, anti-inflammatory, really good for calming things down. Whether that's, sort of hyper emotional stuff or calming the skin down from like eczema or a rash or acne. Then we have peppermint. I like that. I would definitely never leave the house without it. It's cooling. And it's kind of like a piece of ice. So you don't have to carry it around. So if you get a cut or like a hangnail, it can be so irritating. 1 drop, you're never thinking about it again. Tension, headache, just put it on your temples or at the back of your neck. Just like a few drops, rub that in. Just because it really has that immediate cooling action. It's like no other oil is like that. And so like a cut, a mosquito bite, you put on a mosquito bite, it's never itching you again. Or if it does, just put on another drop. You got hours of non-itch there. Myrrh to me is from the sun. I mean, it's from a bush, but it's really got his sun energy, and it's great for scars and melasma, which is when parts of the skin get discolored, and it helps to clear that up. Also to oils like sea buckthorn. Sea buckthorn's a supercritical extract. So some of the supercritical extracts are very much like an essential oil, and some are more of these hybrids almost, because the sea buckthorn has like all of the essential oil components, but then it also has lipids and fats and some rare omegas in there, like omega-7 and phytosterols. So it's kind of this combo, and it's fatty to touch, but it's as potent as an oil. And it's orange, and it's from that beautiful berry that it's really high in vitamin C that can grow in Siberia. It really thrives on our land. And that's making that sea buckthorn best skin ever orange. And that is so super lovely for the skin. You know, from scars to melasma, you can combine that with myrrh. It's just gorgeous. And then ylang is beautiful. It's distilled in Madagascar generally. That's where I feel like the best is from. And that oil is super abundant in its distillation. It's so abundant that it's actually one of the only oils that they do in layers of distillation. So generally when you're buying frankincense, you're getting the frankincense that was distilled. But with ylang, they have ylang complete, which is the whole thing. They have ylang extra, which is like the first half an hour of the distillation, and it's so rich and fragrant and floral. Then you have like ylang 2 and ylang 3. And so that'd be like the next half hour, 20 minutes, and then the next half hour, 20 minutes. So we're always getting the, ylang complete and the ylang extra because it's the best. Cardamom is, it's like an aphrodisiac. It's great for oral care. It's a great aroma. Oh my God, there's so many. Marjoram's so great for sleeping. It's like really more calming in that way than lavender, and they're great combined. It's good for moon time. It's really good on muscles for massage. It's got an analgesic quality. And cinnamon is one to note. It's always good to read the Latin name of what you're buying, and hopefully it's accurate, because you do not want something that's cinnamon but actually cassia bark. And you want to be using cinnamon bark instead of cinnamon leaf. And cinnamon's something that should always be diluted when used because it's very hot. And it can be quite sensitizing on the skin. There's a realm of oils, the citruses, along with angelica and neroli. Neroli's from orange blossoms, that are photosensitizing. So you don't want to be applying them directly and then going into the sun, because it will create a different kind of sunburn, which isn't good. So that's also good to know, and a good reason to dilute those oils.
Listen to what your skin has been trying to show you for years. That it's time to stop covering the largest organ of our body with makeup, creams, and lotions that stop it from properly doing its job. Helping the good vitamins in and let the bad toxins out. Investigate rashes, dry skin, acne, age spots, or eczema that serve as warning signs for other illnesses in the body, such as leaky gut, parasites, and certain autoimmune diseases. Take the time to listen to your body and discover the underlying health issues that may be causing your skin problems.
Think twice before you slather on unknown over-the-counter creams or take a medicine without thoroughly investigating all of the side effects.
Again, you may choose to use a little blemish cover-up or foundation to deal with the occasional acne flare-ups, but don't forget to consider how that blemish got there in the first place. Diet, hygiene, supplements, stress reduction, and certain natural medicines all play key roles in keeping our skin healthy. God bless you in putting your best face forward, and thank you for joining us on our continuing Women's Health Secrets journey.
Hold on just a minute right now. I think that we might have just given them a huge information overload. What do you think?
Yeah, I think a little.
So, I do have a solution for that.
Yep, what is it?
It's to summarize everything into a few key points that you can write down right now.
Let's do it.
All right, you ready?
Yep.
Okay, so skin is our largest organ and a crucial detox pathway for our body. Some have called sleep the fountain of youth for your skin. Be kind to your skin. It is possible to damage your skin with too much exfoliant and excessive product use. Don't immediately reach for the cover stick. Look for triggers that cause your skin to break out. Sometimes it's not a straightforward answer. People often do not realize that there may be deeper underlying health issues that are causing their skin problems.
Sometimes the root cause could be internal, like hormones, and other times it could be external, like diet, medicine, creams, or makeup. Investigate the rashes, dry skin, acne, age spots, or eczema that serve as warning signs for other illnesses in the body, such as leaky gut, parasites, and certain autoimmune diseases. Remember that Dr. Peter Kahn said that your body is already programmed to detox. It's already programmed to get rid of parasites. It's already programmed to heal from autoimmune disease. The only reason that we can't heal or you still have symptoms is because either your body can't run the program because something's blocking that program, or you have way too much for the body to handle and it's overwhelming the system. Diet, hygiene, supplements, stress reduction, and certain natural medicines all play key roles in healing the largest organ of our body.
So there you go. There's some key takeaway tips of what you learned today that hopefully you wrote down. If you didn't, scribble them down, rewind the video, listen to it, and make sure what?
You apply.
Make sure you apply. That's what I was going to say. And
yeah, we love you all.
Get the benefits and take care of yourself. Can't wait to see you in the next episode.
See you soon. Before closing this page, I want you to take an opportunity to get the Platinum Program, which has been carefully designed to meet women's specific health needs and address our common health struggles. The natural remedies revealed inside are the same remedies that completely and utterly changed my health all around and wiped out my depression and anxiety. The Platinum Program gives you all the tools to succeed and to make your healing journey as simple and as profound as possible. You get continuous support from me and our dedicated team for another 12 months, simply by being a member of our Facebook community. But the only thing is, you need to act fast because the doors are closing, we're gonna move forward with the program, and we don't want you to miss out. Once we close the doors for the Women's Health Secrets program, you won't be able to access it anymore. Not now and not in the future. And I wouldn't want you to miss out on this if you need help to heal your body and your mind. Remember that by following our doctor-approved protocols, you will see results in weeks. But that's only if you read, you listen, and you watch materials and implement what's inside the Women's Health Secrets program and all the healing protocols and the bonuses that go deeper than the information you're watching right now. So click the button below to get started, and thank you for joining us during this episode.